Hello there, and welcome. It's so lovely to see you today. You're here for a routine dental examination and cleaning, is that right? Wonderful. There's absolutely nothing to worry about. We'll go at a slow and gentle pace, and I'll explain everything as we go along. You can just sit back, relax, and let me take care of everything, okay? Good. Before we begin, I just want to make sure that you are completely comfortable. So feel free to adjust your position in the seat if you need to. I can adjust the seat for you if you like. Just get as comfortable and relaxed as you can. That's my goal for you today. To feel completely comfortable and at ease. That means at any point, if you would like to take a break, just let me know and we can stop and have a rest, okay? Of course. Very, very good. I will be wearing gloves today, so you may hear some rustling sounds as I put those on, and perhaps some tapping or gentle clicking sounds just as I prepare the instruments that I'm going to need. Just have them over here to my side on a little tray, ready and waiting. Before we start the examination, I'd just like to go over your medical history. Would that be okay? Have you noticed any sensitivity, discomfort or bleeding gums lately? Okay, thank you for sharing that. Have there been any changes in your medications or in your general health since you last visited the dentist? That's great, okay. Everything sounds good, so let's go ahead and start with a thorough visual examination of your mouth. Alright. Good. Lay yourself back then and just open your mouth wide for me and we will begin. I'm going to use my dental explorer. That's this little tool here. And also a mirror, just to examine your teeth one by one. I'll be going over each tooth carefully, looking for any areas of concern, and I will be recording my findings as we go. You might hear a little tapping sound as I examine each tooth, but it's nothing to worry about. It's perfectly gentle. If anything feels uncomfortable, just raise your hand and I will stop right away. Okay? Let's begin. So I'm starting by the upper right quadrant. I'm just going to count your teeth firstly to see how many we have present. So we have 8, 7, 6, 5, 4, 3, 2, 1, and we have 1, 2, 3, 4, 5, 6, 7, and 8. And then in the lower right quadrant we have 8, 7, 6, 5, 4, 3, 2, and 1. And we have 1, 2, 3, 4, 5, 6, 7, and 8. So we have a full set of lovely looking teeth. So I'm just going to examine them a little more closely, individually, one by one, to see what's going on with each one, okay? Right, here we go then. So this upper right third molar, fully erupted there. No visible decay, slight staining on the occlusal surfaces, no caries. And the second molar, we have occlusal surface intact, no visible fractures or cracks. There is mild plaque accumulation on the buccal side. And then your first molar. This looks to be sound. A slight staining on the central groove, but no visible decay. How are you doing so far? Is that alright? Can I carry on? Don't need a break. Okay, good. Second premolar then, there is a small amount of plaque on the distal side. No signs of enamel wear. And the first premolar, no visible concerns, marginal ridge intact. Canine on this upper right quadrant, we have a strong and healthy canine. Slight calculus along the gum line. Lateral incisor, no decay, no visible fractures. Gingival margins look healthy. Your central incisor, no visible concerns. Slight staining on that one, but otherwise sound. So the upper right quadrant looks all good to me. Just a little plaque build-up in common areas, but nothing too concerning. So let's move on to the upper left quadrant now. And we will start with the central incisor. That is your front tooth on the left side. Okay, so central incisor here, no fractures, slight translucency on the incisal edge, no visible decay. Then the lateral incisor, no visible concerns, no plaque deposits. Moving around to the canine, we have a marginally receded gum line here, but no sensitivity observed. When I touch this tooth here, you feel that? Any sensitivity there at all? No. What about when you're eating or drinking? Okay, so no sensitivity recorded on that one. And then moving around to the first premolar. No visible concerns here. Occlusal ridges intact. And the second premolar. So we have a mild plaque accumulation interproximally on this one. No signs of caries. Then on your first molar on this upper left quadrant, occlusal surface sound, mild staining along the grooves. Second molar, no fractures, slight roughness on the distal surface, and then finally that third molar, which is partially erupted. No visible decay, slight inflammation around the gingival margin, which is not unusual. Has that wisdom tooth been troubling you while it's been making its way through? You have pain back there. Sensitivity when you're brushing. That's often the way with those. They can be quite troublesome, can't they? But it's making good progress and it's on the way through. So I'm just going to repeat that process now, but I'm going to be looking at your lower quadrants instead, so the lower part of your mouth. Would you like to close your mouth just for a moment or two? Just to really relax that jaw. Good, that's it. I know what it's like. Sometimes if you have to hold your jaw open for a while, it can start to ache, can't it? Very good, okay. Are you ready to continue? Very good, okay, let's have a look then at this lower quadrant. So we have your third molar, that's your wisdom tooth down at the bottom here, and that is fully erupted, no visible decay, mild calculus on the lingual surface. Second molar, no visible caries, slight wear on the occlusal cusps. Your first molar down here, no fractures. Mild enamel demineralization near the gum line. Just slide there. Okay, second premolar. No concerns there. Interdental spacing is normal. Okay, your first premolar, no visible decay. Some plaque near the distal margin. And your canine on this bottom left side, no fractures, gingival firm and healthy. All good. Your lateral incisor. Sound, no visible plaque, slight staining near the incisal edge. Okay, going around to the front then. Central incisor. No caries. Just slight roughness on the lingual surface. central incisor, no visible decay. Mild to gentle recession noted. And the lateral incisor here is healthy. Slight plaque accumulation interproximally. On the canine then there is no visible wear. Occlusal contact normal. First premolar no caries. Slight roughness on the buccal surface. And the second premolar. No visible concerns. Slight calculus accumulation. First molar. Minor occlusal staining, but no signs of enamel wear. Second molar, we're nearly there. No fractures. Mild plaque on the lingual cusp. And then finally, that very last wisdom tooth on the bottom left side there. So the third molar. That one is fully erupted, but there are no caries, just mild inflammation at the gingival margin. Okay, your teeth are looking very healthy overall. So really good news. There are just a few common areas where plaque tends to build up, and we can deal with that during the cleaning shortly, okay? Good. Alright, now that we have completed the visual inspection of your teeth, I'm going to move on to looking at your gums. So I'm going to be using a periodontal probe just to measure the pocket depth around each tooth. This helps us to determine the health of your gums and also just to check for any signs of gum disease. You might feel a very, very gentle pressure as I do this, but it shouldn't be uncomfortable. If anything feels sore or you don't like it, then just let me know and I'll stop right away, okay? Good, okay. I will call out the measurements as I go. The numbers probably won't make too much sense to you, but healthy gums typically have a depth of between 1 and 3 millimeters. Anything deeper could indicate some gum inflammation or early stage gum disease, but we will assess as we go. I'm sure it's all going to be fine, okay? Good, here we go then. I'm going to start with the upper right quadrant again. So third molar, 334 millimeters. Slight inflammation around the distal side. Second molar, 3, 2, 3 millimeters, normal range. First molar, 2, 2, 3 millimeters, healthy. Second premolar, 2, 2, 2 millimeters. No signs of gum recession. We have then the first premolar, 2 to 3 millimeters. Interdental papilla intact, and this canine, 2 to 2 millimeters. Ginger firm and pink. Lateral incisor, 2 to 3 millimeters. No concerns. And the central incisor, 2 to 2 millimeters. Healthy gum attachment there. It's all good. So the upper right quadrant looks great overall. Just a slightly deeper pocket on that third molar. That's your wisdom tooth, which is perfectly common. I would just recommend that you maintain some gentle brushing in that area just to keep the gum line really nice and clean and healthy there, okay? Good. Let's move on then to your upper left quadrant. So starting again with the central incisor, we have 2 millimeters. Excellent gum attachment. And the lateral incisor, we have 2 to 3 millimeters, and no inflammation noted. And on that upper left canine, we have 3 millimeters with a slight recession as we previously discussed, but no sensitivity reported. On your first premolar then, we have 2, 3, very slight pocketing on the distal side. And on the second premolar, we have 3 millimeters. Mild inflammation, but no bleeding on probing. On your first molar, 2, 3, 4 millimeters. Slight pocketing on the lingual side. On the second molar, we have 3 millimeters. Healthy, but that slight plaque accumulation interproximally, which we noted earlier. And then that back partially erupted wisdom tooth. 4, 5. Mild inflammation around the gingival margin. So I know it probably is quite sore when you're brushing around that wisdom tooth, but do keep at it. It is something we'll just monitor at your next visit, okay? Good. Let's move down then to the lower quadrant. On the left side, so we have this third molar, 4, 5, mild gingival irritation. Second molar, 3 millimeters, healthy attachment. First molar, 2, 3. No concerns with that one. 2 millimeters. Excellent tissue health. And the central incisor, 2 to 3 millimeters. No issues with that one. Okay, so finally onto the lower right quadrant. So the central incisor here, we have 2 millimeters, no issues. And on the lateral incisor, we have 2 to 3 millimeters. Healthy attachment on that one. And on the canine, we have 2 millimeters and firm gingiva. First premolar, we have 2 millimeters, no recession. On the second premolar, we have 3 millimeters, slight inflammation near the distal. First molar, we have 3 millimeters, slight roughness along the gingival margin. Second molar, we have 3 millimeters, mild gingival redness on the buccal side. And finally, last but not least, on that third molar, your wisdom tooth on the bottom left quadrant, we have 5 millimeters, mild pocketing, and again we will monitor that on your next visit. So overall, your gums are looking very, very healthy. You're obviously doing a good job of brushing not just your teeth but your gum line as well, which is so important. The vast majority of your probing depths are in the normal 2 to 3 millimeter range, which is really, really good. There are a few areas, particularly around your wisdom teeth, which are slightly pocketed, so we really want to just keep monitoring that and just keep consciously brushing the teeth and the gums in those areas to try to keep those areas as clean and as healthy as possible. Does that make sense? Good, okay. There's no bleeding on probing, so your gums aren't bleeding, which is a great sign. It tells me that you're doing a good job of flossing and cleaning interdentally as well, not just brushing the teeth. So credit for that. Your gum tissue looks firm, pink, and very well maintained. So well done. Okay. Close your mouth again for a moment or two. Just give it a little rest while I prepare the next tools. So now I'm going to examine the tissues inside your mouth, your tongue, your cheeks, the roof and the floor of your mouth, just to make sure that everything is looking healthy. So if you wouldn't mind opening wide for me again. Good. I'm afraid I'm just going to pop this little tongue depressor into your mouth there, just so that I can have a really good look around without your tongue getting in my way. There we go. Very, very good. Just having a look in there. Wonderful. And I'm going to remove that tongue depressor now, and if you could just lift your tongue up to the roof of your mouth for me so I can look underneath your tongue. Good, that's it, very good. Okay, that all looks great. for any swollen lymph nodes, but everything feels completely normal. And I'm just going to do a quick oral cancer screening. It's a perfectly normal part of the process. So all I'm going to do is place my fingers inside your cheeks there. That's it. And I'm just feeling around the inside of your cheeks and also underneath your tongue. I do apologise. I know that feels a little bit strange. Okay. Good. Everything is nice and healthy. Great news. So I'm going to move on now to checking your plaque and tartar buildup. We've already had a bit of a look at that, but I'm going to run an explorer around your mouth. Looks like this. And all that's going to do is just check for any rough areas on your teeth that we're going to need to focus on during the cleaning, okay? Mild calculus present on the lower anteriors. Slight build-up on lingual surfaces of the lower molars. Okay. No. No significant deposits anywhere else other than already noted. Okay, you've done a really great job of taking care of your teeth. There are just a few areas which need a little bit of extra attention, and we will take care of those now during the cleaning. Okay? Good. Alright, so we're going to do a scale and polish today. So I'm going to begin just by gently scaling away any tartar buildup on your teeth. It will be done manually. I'm not going to use an ultrasonic scaler today. There's no need for that because you don't have much going on. And I'm going to work in sections, just starting with your upper left. So here we go. Moving around to the upper right quadrant. And on to the lower quadrant, so starting this time with the lower right. to apply this to your teeth with a little brush. Okay, and onto the lower ones. Good. Okay, let's put that away. Now I'm just going to polish your teeth using a special slow rotating brush. You might hear a gentle vibrating sound, but it's not going to be at all uncomfortable. I'm just going to work over each tooth individually and carefully, and we're going to make sure that everything feels silky smooth for you, okay? Lovely, here we go then. Good, great. That's looking much better. I'm just going to have a quick look in here. Wonderful. You've done a really good job today. You've been so patient. I'm just going to do a final floss and some interdental cleaning just to remove any remaining debris, and then you can rinse and you will be good to go. Alright? Okay, so I'm going to start with an interdental brush. This just goes into the spaces in between your teeth, so it cleans between your teeth by the gum line, just removing any kind of bacterial film that's built up there. Okay, so here we go. I will start centrally. brush a few times forwards and backwards in the spaces between each tooth. This lower quadrant. I'm going to use a string floss. And I'm just going to work this up underneath the gum line again to really give those spaces a great clean and remove any bacteria. And the lower arch. Good. Here. There we go, very, very well done. I'm going to remove my gloves a moment. I have a special fluoride rinse for you here, so if you would just like to take this one, swirl it around in your mouth and then just spit it out into the sink. Okay, here you go. Good, that's it. Give your mouth a really, really good rinse out for me. Just for about 30 seconds. It's going to help to strengthen your enamel and provide some extra protection. Good. Okay, so let me just have a final look inside your mouth. I'm not going to touch now. Now that you've rinsed. Brilliant. Well done, you've done a fantastic job. Everything is looking really good. So just a couple of reminders. Try to remember to floss daily, twice a day if you can, especially around those lower front teeth where people do tend to get a little extra build-up of plaque in the backs of their lower front teeth. Also, if you notice any sensitivity in any areas, then do let let me know at your next visit. I'd like you to really concentrate on consciously brushing around those wisdom teeth as well, especially the gum lines and things, just to see if we can keep the gum lines as healthy as possible. I am going to give you some special mouthwash which will really help to keep the gums as healthy as possible. It's going to reduce any areas of slight inflammation that you have. It's a really good mouthwash for that, so hopefully that will really help things too, okay? Does that all sound alright? Good. Well, you did an amazing job today, and I hope that you are feeling refreshed and relaxed. You are, of course, more than welcome to sit here for a few moments if you'd like to do so before